Good evening. Good evening, one and all. A very warm welcome to all of you to the class. It's extremely cold here. It's raining. Okay, the weather is very bad. It's extremely, it's we are all shivering. Okay, yes, this winter is, as we say, it is atiyoga. Hmm? शीत गुण का अतियोग हो रहा है इस year में, last part of the year. So let us start with the leftover part of second day. Okay. So कुछ topics हमने third day में discuss किए थे, examination of patient general. So आज हम continue करेंगे some of the examinations, some of the different parts examination को आज continue करेंगे. So we shall have that for 15 minutes and later on have the interactive session, right? So let me just start this. So on the second day of the course, we discussed about some of the basic concepts like Panchamahabhuta concept, dosha, dhatu, mala, and then basic examination, that is trifold, eightfold and tenfold examination is over. Now we will be discussing about in detail examination. Okay, hope you all remember Panchamahabhuta concept, Vata, Pitta, Kapha, everything, right? So examination of disease and deceased. इसमें तो त्रिविध परीक्षा, yes, it is done. Ashtavadha pariksha is also done. Dashavidha pariksha also. Let us start with Nadi pariksha. So Nadi, आप सबको मालूम है, Nadi is the pulse. So कैसे examine करना है हमें Nadi? So generally this specific topic नाड़ी परीक्षा तो 14th century के बाद बहुत ज्यादा develop हो गया. So that was a golden period, 14, 15, 16 centuries. These eras में, this era में नाड़ी विज्ञान को बहुत प्रामुख्यता मिली because the growth and development of this specific science that happened very well during that time. Yes, let us see. So often the Vaidyas, they would hold the hand of the patient, the wrist part. See, you can see in the picture, the patient's left hand is being seen or examined by doctor's right hand. So always doctors should use the right hand generally because that is more, what to say, uh, convenient. And yes, so right hand is used. If it's a lady patient, left hand is seen. For a male patient, generally right hand is seen. So hand preference for males it is right hand and for females it is left hand. So कैसे examine करना है? What is the method of examination? Right hand of the doctor to be used as shown in the figure, supported by left hand. So यहाँ से, that is, देखिए ये मेरा thumb है, right? ये thumb के root, this forms the root of the thumb. So इस line है ना, palm का ये line, इस line से 1 finger gap छोड़ना है हमें और इसके बाद का 1, 2, 3. So 3 fingers. These are, see, this is the hand. Like this we need to hold, leaving 1 finger gap here. Okay. So the 3 points. हमारा, that is वैद्य का index finger will assess the vata dosha. Hamara middle finger will assess the pitta dosha and ring finger will assess the kapha dosha. Remember, right hand to be used as shown in the figure, supported by left hand. Then leaving a 1 finger gap between wrist joint of the patient and the index finger of the doctor. That is the point of assessment. So, देखिए, first index finger is showing Vata over there. एक सांप है वहां पर. So what does this depict? This shows that the movement that we can understand by this is like as if that particular nadi, Vata nadi, is like movement of the serpent, the slow movement like this. I mean, not the slow, the swift movement. Okay. And then second is jumpy nadi, that means just like मंडक, मंडूक की तरह, frog की तरह वो jumpy होता है generally. Second nadi which depicts pitta, and the third nadi which depicts kapha, that shows hamsagati, almost very clean and without any sort of disturbance. So such will be the nature of this kafanadi. So देखिए, vata dosha, pitta dosha, kapha dosha assessed by index finger, middle finger and ring finger of the vaidya, kept at specific points as shown. Okay, so this is about नाड़ी परीक्षण. So ये कब करना है पेशेंट को, नाड़ी, पेशेंट का नाड़ी कब देखना है हमें? So when this question is asked, I mean, oh sorry, let me just enlarge. Best time for examination of nadi, just a minute, I will enhance the visibility. Okay, best, oh, why it is going like this? So best time for examination of nadi is early morning. Okay, that is best time. But nowadays it is not possible for doctors and patients to meet at specific time. In olden days, तो वैद्य लोग ये रोगियों के घर जाते थे. So that was convenient. They used to stay there for some time. So that used to be convenient for them. So early morning is the best time. After the patient is free from morning rituals. इसका मतलब है वो बाथरूम वॉशरूम जाने के बाद, फेस और हैंड्स वॉश करने के बाद, आराम से काम से बैठने के बाद ये नाड़ी का एग्जामिनेशन होता है. And then on an empty stomach, of course, so much early in the morning, we generally don't have anything, isn't it? So that is the best time for seeing the nadi. It can be done. Nadi parikshan can also be done at other times in cases of emergency. Emergency जैसे situations में नाड़ी परीक्षण कभी भी कर सकते हैं, right? But generally to assess the dosha avastha of the patient, early morning nadi is seen. Then worst situation for examination, कब एग्जामिन नहीं करना है, कब एग्जामिन करने से हमें अच्छी तरह का assessment नहीं होता है. So that is just after bathing or eating. As soon as the patient comes out of the bathroom after having bath, so that particular nadi is not to be considered, क्योंकि दोषावस्था कुछ changes होता है. Or soon after eating, don't examine. Whenever the patient is very hungry, whenever the patient is thirsty, and whenever the patient is drunk, and all those things have to be considered before examining the nadi. Okay, so these are some of the specific times when nadi should not be examined. Just a minute. Oh, I only did something. I'm unable to move this. I really don't know why, what is happening. The slides. When the patient is thirsty and hungry, the nadi should not be examined, right? Next, nadi parikshan, pulse examination. So vata dosh, which is assessed by the index finger. So one finger gap from base of the thumb ऐसे पकड़ के एग्जामिन करना चाहिए. इसका movements तो snake like, leech like लगता है, and its quality is generally odd or ragged or quick movements. Okay, then pitta nadi, which is depicted by middle finger. So right next to vata nadi, the movement will be jumpy like the frog. So ये तो sharp, edgy, jumpy movements हम देख सकते हैं पित्त नाड़ी का. Then kapha nadi, which is depicted by the ring finger next to pitta nadi. Swan like movement is seen, slow flowing movement. Okay, so this is how generally it is seen. Then iske baad, yes, let us see nadi observations from some patients. Slow pace, weak nadi in emaciated person. This shows that Agni is very less. Then fierce and swift nadi. This shows increased digestive fire. So बहुत ज्यादा है Agni. The person is very hungry. His digestive ability is very good. Then that means there is swift nadi. Then increased Agni. Swift nadi is generally seen in fever. Then jumpy nadi, too much of jumpy shows that irregular nature of Agni. So Sangrahini type of disease is indicated here. I mean, it is showing, pointing towards that. That is IBS. IBS is irritable bowel syndrome. Then bent, slow, difficult to observe nadi. So Vata Vyadhi, Vata Rakta. Disorders of nervous system, joints, these are all generally seen when such nadi is observed. Fast and arrhythmic nadi shows mental disorders. Fast and arrhythmic nadi shows mental disorders. Intense but slow nadi shows श्वास रोगा or respiratory system ka kuch problems. And then, so just not these many, we have many more things to share with you all. लेकिन time के constant के वजह से only this much we are able to share. So if you are more interested, definitely then you can join our advanced courses जहाँ पर same topics and many more topics will be explained in detail, right? So this is about nadi parikshan. So आजकल तो नाड़ी विज्ञान में there are so many institutions which are teaching नाड़ी विज्ञान, especially for the doctors, BAMS doctors and MD doctors. Without talking anything, the doctor just sees the nadi and writes the prescription. So much accuracy we can find in doctors nowadays, right? Yes. So next is sorry, Mutra and Malapariksha. So according to this questionnaire, specifically examination of urine, examination of feces is done. Color, smell, stickiness, presence of unwanted substances like blood, dirt, worms, etc. These are seen. Sensations में अगर यूरिन पास करने में या फिर स्टूल्स पास करने में कुछ डिफिकल्टी या बर्निंग सेंसेशन होता है, ये सब पूछना चाहिए. और timings of urine and stools, that also has to be asked. Frequency of urine during day and night, that also should be asked. Whether the person is passing before meals or after meals, a very detailed history, very detailed examination is preferred for taking up the case history. Then consistency kaisa hai, associated symptoms, what are all these are generally seen. See, what happens is sometimes generally mutra, that is urine ka normal color hai straw yellow color. So that is a specific term that is given. So straw yellow color and motions ka to stercobilinogen के presence के वजह से yellowish color दिखाई देता है. And the smell should be normal. If there is any specific smell or any obnoxious gas का smell आ रहा है, इसका मतलब है there is कुछ infection. Stickiness also directs towards lack of Agni or loss of Agni, less Agni. Then presence of unwanted substances, especially blood in urine and small crystals like in the urine, and in the motions also blood, dirt, worms, etc. These are generally seen. So sensations में यूरिन पास करने में या मोशंस पास करने में कुछ डिफिकल्टी या बर्निंग सेंसेशन हो सकता है. Timings, frequency, all these should be known better. Next is जिह्वा परीक्षा. जिह्वा का मतलब है जीभ. So tongue examination. So you know that doctors ask the patients to open their mouth and show the tongue, isn't it? So by seeing the tongue, many diagnostic features can be found which help in knowing about the disease which the patient is suffering from. So tongue is a very good diagnostics tool. जीभ एक अजीब सा या फिर यूनिक सा साधन है जिससे हमें अंडरलाइंग डिसीज के बारे में इंफॉर्मेशन मिलता है, राइट? सो दैट इज जिह्वा परीक्षा अकॉर्डिंग टू दोषा विसिएशन. सी, टंग, अगर टंग का कलर नॉर्मल है so it should be blood red in color and feel should be moist, appearance is clean, it should look clean, there shouldn't be any coating, any map like structures on the tongue. Okay, so that is normal tongue. अगर हमारा सिस्टम वात दोष से बहुत विशिएट हो गया है तो ब्राउनिश ब्लैक कलर कैन बी सीन एंड देन ड्राई रफ coldness would be seen, and then the tongue, on the tongue cracked appearance is generally seen. So that indicates vata का कुछ involvement in the illness. अगर पित्त दोष से वो afflict हो गया है तो the tongue appears reddish black, hot, swollen with foul smell, may or may not be coated, so that is pittaja. And agar our body is afflicted with kapha dosha, so tongue appears pale and whitish, slurry or sticky type, and there will be coating. So कभी कभी बच्चों में हम ज्यादा देखते हैं कि टंग कोटेड रहता है. They would secrete lot of saliva, and when they sleep continuously that saliva will be coming out. See, all these are indicated or indicative of little bit of excess kapha dosha. अगर शरीर में कुछ secretions ज्यादा है तो all these would happen. Then mandagni, agni के मंद होने से भी all these problems are seen. Next, sannipataja means when all the three doshas are involved. Vata, Pitta, Kapha. So all the three together is called as Sannipata. Sannipataja type of problems may generally tongue appears mildly blackish and mildly thorny, may or may not be coated. It depends, right? Then अगर कुछ धातुओं का विसिएशन दुष्टि हो गया है तो we can see many special features in the tongue. For example, रस धातु की विकृति से we see dry tongue as in dehydration and menstrual disorders. रक्त धातु की विशेषण से हम तो पेल टंग देख सकते हैं as in anemia. Central cyanosis, you know that इसके कंडीशन में और ओवर कंजम्पशन ऑफ अल्कोहल, ऐसे कंडीशंस में the tongue becomes extremely blue. Indigestion या फीवर, ऐसे कंडीशंस में we see coated tongue, and the tongue's functioning may also be affected. Like हम तो आहार द्रव्य का रुचि, that is रस का ग्रहण ठीक तरह से नहीं कर पाते हैं, that is tastelessness or cracked tongue. So all these are seen. When there is too much of mental stress, then also coated, cracked, such what to say, affliction of the tongue may be seen. So coated, cracked tongue with tastelessness, that is seen. So this is about some specific examinations. So what all we have discussed. Second day का class तो 2 extra दिन हम एक टॉपिक के बारे में डिस्कस किए हैं. सो सेकेंड डेज टॉपिक वाज व्हाट इज आयुर्वेदा, आयुर्वेद का मूल उद्देश्य क्या है, दैट वाज वन. नेक्स्ट वाज पंच महाभूत सिद्धांत, दैट इज द कॉन्सेप्ट ऑफ 5 एलिमेंट्स. लोक पुरुष साम्यवाद वी डिस्कस, जो भी है एक्सटर्नल यूनिवर्स में ये सब हमारे अंदर भी है. वी हैव एन इंटरनल यूनिवर्स इनसाइड आवर बॉडी. So all the elements that are there outside, we also have everything inside our body in the form of doshas or whatever. I'm really sorry today. Okay, so all these we can see. Kapha dosh, probably kapha and vata have increased. I need to make some arrangements to reduce all these. So all those we can see generally. And then yeah, जो भी external universe में है हमारे अंदर भी है. दोषास के बारे में हमने डिस्कस किए हैं. धातुओं के बारे में, दोषास में शारीरिक दोषास और मानसिक दोषास. इसके बाद धातुओं के बारे में, इसके बाद मलास दैट इज स्टूल्स, यूरिन, फीसेस, ये सब विषयों के बारे में हमने डिस्कस किए हैं। एंड देन इसके बाद ये एग्जामिनेशन, जनरल एग्जामिनेशन तो ट्राईफोल्ड, 8-fold एंड 10-fold एग्जामिनेशन वी हैव सीन। और इसके बाद हमने तो causes for diseases that also we have discussed. So this ends the second day's syllabus. So now after that, on the third day, we have all assessed our prakriti, right? So all of you people have assessed your prakriti, whether it is vata, pitta or kapha, vata, pitta, pitta, kapha or vata, kapha, or if it is sannipata, you have also assessed that part. Next, yesterday we have discussed about Agni. Agni was quite difficult or easy to understand? Agni and Ama के बारे में हमने discuss किए हैं. So today we completed everything of this week. So now let us move on to the interactive session, interactive part. So I have received some questions. पहले मैं वो सब questions को answer करूंगी. इसके बाद we will have message or personal talks. Okay, so my video will be off when I'm answering the question, because I will have to tilt the mobile and look for the document. So document, yes, I will try to find. Just a minute. Yeah, many questions I have received. So let me just check. Yeah, query. First question is by Anjali. Anjali has just written as Ayurvedic. That's all, nothing else. Anjali, I think you have not completed your question. Please, you can complete your question so that it will reach me and I'll be able to answer. Next is by Anarul. Anarul is asking, saying, subject of Ayurveda is uncommon part of me. Yes, of course it is, because yeah, it is not so common as you said. So explain details with examples and slowly. See, this course has been designed such that 20 days में आपको बेसिक जानकारी होगा. So अगर मैं एक क्लास में इससे भी ज्यादा सिलेबस कवर करना है, या फिर यही सिलेबस को अगर ड्रैग कर दूंगी, तो that curriculum will be spoiled. Then and there itself I'm trying to explain, but anyway it will be repeated for many times so that you will be able to understand well. So please don't miss classes and listen to the classes. I'm very sure by the end of 20 days you will have a very nice, I mean, what to say, exactly in a nutshell you will be knowing what is Ayurveda. Don't worry. Yes, initially it feels so because so much of Sanskrit terminologies, right? Then various new terms. Yes, I will explain. Don't worry, Anarul. Next is Meenakshi Tyagi. She is saying, could you please provide examples of local varieties of wheat? देखिए आजकल तो हमें वीट से ज्यादा वीट फ्लोर मिल रहा है, राइट? सो वीट्स में जो भी जवारी है, दैट मीन्स विच एवर इज organic, whichever is basically desi, that can be purchased. I really don't know if there are many varieties of wheat available here and all in South India. We, by the term wheat, we can have only one type, that's all. Not many types are available in all the places. Okay, then Garima is saying, what is the question? Regarding sattva, rajas and tamas food, and how does it affect our mind and body? Yes, so very nice question. So I have already explained this, but I'm very happy to repeat that part once again. Sattva ka matlab hai total positive thinkers. Generally, I will tell you what is sattva, raja, tama first. Then we will go on to the sattvic food, tamasic food, all these. So sattva is totally a positive thinker. There is not even a single negative thing of sattva. Then rajasic or rajogun से तो two aspects है इसका. First is positive and another is negative. Positive में वो ambitiousness, aggressiveness to some extent comes under this राजसिक गुण ओनली, लेकिन इसका नेगेटिव साइड तो ओवर एंजाइटी, एंशियसनेस, and then anger, jealousy, all these come under rajasic good. Okay, tamasic ka matlab hai positive part is lot of patience and negative part is overly lethargic. So much lethargic that they are not even able to carry out their daily activities on a normal pace. So this is basic introduction to सत्व रजत तम. लेकिन फूड्स में भी हम तो कैटेगराइज कर सकते हैं कि सात्विक फूड, तामसिक फूड, राजसिक फूड ऐसे, क्योंकि कुछ सत्व गुण वाले सात्विक फूड लेने से हमारे मन में सात्विकता बढ़ती है. सो इसलिए हम हमेशा तो सात्विक फूड लेने के लिए ही बोलते हैं. लेट मी जस्ट एक्सप्लेन दिस पार्ट टू यू with this example. Please look into the screen. Please look here. Sattvic diet, they are neither too sweet nor salty nor spicy. ये तो आश्रमों में जो भी टाइप ऑफ आहार मिलता है, we can consider that as sattvic food. Consuming sattvic food helps in purifying our body and mind, right? So that is why sattvic food is only advisable all the time. So कौन सा food sattvic है? All the fresh food that we prepare at home on a daily basis, the food grains such as rice, wheat, oats, legumes categorized under sattvic food. Further, fresh green vegetables, fruits, and lightly roasted seeds, nuts, these are also considered as sattvic. Fresh milk is sattvic, but after we pasteurize, it becomes tamasic. लेकिन वो प्योरिटी के वजह से हम तो पास्चराइज करना ही प्रिफर करते हैं, राइट? The environment where we are taking food should be clean and pious, so that also adds more for the satvikata of the food. Then rajasic food, meats and fish that are spicy fall under rajasic food. See, remember, ये तो हमारे मन में भी राजसिकता उत्पन्न करती है, right? Pungent vegetables with excessive starch intake like potato, cabbage, broccoli, and cauliflower, all these fall under rajasic food. Alcoholic drinks, preserved food, fried food, too much of coffee, tea, these are all some other foods that have rajasic nature. So this is rajasic. Next is tamasic diet. So apatya ahar mentioned in text is tamasic. Garlic, onion. See, I being an Ayurvedic doctor and also a teacher of these medicinal plants, okay, so I would prefer all of you to consume garlic, onion, yes of course, लेकिन इसका तो एक और इफेक्ट भी है, लाइक मन में एक तामसिकता ज्यादा करती है. So have in moderation garlic and onion. I wouldn't say totally avoid, but you can, because अगर हम ये सब्सटेंसेस का मेडिसिनल प्रॉपर्टीज तो कंसिडरेशन में करते हैं तो दे आर एक्चुअली वेरी गुड. उड़द दाल थोड़ा सा कम कीजिए. फास्ट फूड टू बी कंज्यूम्ड, not consumed at all. So this is about sattvic, rajasic and tamasic food, right? So let me move on to the next question. I hope it is clear for you now, Garima. Next is by Meenakshi Tyagi. Meenakshi Tyagi is asking regarding influence of food selection. So people who reside outside India, if they start eating olive oil, would that be good for their system? As from childhood, they are used to eating mustard oil, peanut oil, etc. Yes, a very nice question again. Logical thinking and application of the knowledge that you have obtained this week. So हम क्या कहते हैं, जो भी आपको suitable है, please use that from childhood. लेकिन अगर वहां पर ये नहीं मिल रहा है, तो you will have to adjust with whatever is available over there. Or if it is possible, try to procure the basic things that from here. Okay, so the basic things which you are accustomed to, you can get it there also. So how would these factors influence their food selection? So how it influences in the sense, if you are accustomed to a specific type of food at your place, that would be good for you at your place. But when you are moving to any other place, certain changes have to be made in your daily routine, and it should be such that it is suitable for that particular environment. So whatever you are using, that also, if possible, use it at least 50%, and remaining 50% try to adjust with the local foods, right? Should they keep, yes, I think I have answered this question. Okay. Next question is by Sharanya. Sharanya is asking, just a minute. In Ayurvedic nutrition, I can see many new terms. Yes, I understand. I need more examples in English. Okay, I guess you're from South. Sharanya, by looking at your name only, I felt. You're also saying I'm not familiar of Hindi language. Yes, this is the problem with some of the students. I understand this. So that is why we are using both English and Hindi. Okay, so 60% English and 40% Hindi. So कुछ लोगों को who are preferring Hindi, they would feel that I'm using more English. जो लोग इंग्लिश प्रिफर करते हैं वो समझते हैं कि आई एम यूजिंग मोर हिंदी. So I think I'm using both. So yes, next is by Shashi Kiran. Shashi Kiran is asking, so someone if grew up, oh, no, sorry, ma'am, if you can give some line sketch or diagrammatic presentation to relate Panchamahabhuta, sense organs, actions and applications. Also its relation to doshas. Yeah, very nice idea actually. We will do this. But now you just try to understand and learn. So shortly we are going to do that also. Okay, Shashi Kiran, good question you have asked. Next question is by Meenakshi. Oh, Meenakshi, I have answered this question. Next is by Ambika. Ambika's question. What are the advantages? पित्त प्रकृति वालों के डाइजेशन प्रॉब्लम कैसे ठीक करे? आई एम सफरिंग फ्रॉम दिस प्रॉब्लम फ्रॉम लॉन्ग टाइम. इसके वजह से, इसके कारण मेरे फेस पर पिंपल्स क्रिएट हो जाते हैं. प्लीज रिप्लाई मी. यस, अगेन you have analyzed it very well. So पित्त प्रकृति, you have assessed yourself as पित्त प्रकृति, correct? So इसलिए कुछ लोगों को ये पित्त की विकृति भी हो सकती है. एक्चुअली व्हाट वी थिंक, पित्त प्रकृति वालों में पित्त स्ट्रांग होना चाहिए. Yes, in some people the quantity is more but quality is not so good. In such conditions this digestion impairments happen. So pitta always represents anything that is hot, because fire plus water is only pitta, no? So pitta is something that is hot. ये hot substance जो हमारे अंदर है, that is which is responsible for digestion, metabolism, everything. So this has the ability to cause digestive problems as well as some manifestations like pimples on the face and all. So इसके वजह से आपको कुछ do's and don'ts के बारे में ध्यान देना होगा. Do's are like, please resort to specific timings of food. Food timings बहुत इंपॉर्टेंट है, क्योंकि अगर हम हमारे पेट को ज्यादा वेट करने के लिए ऐसा सिचुएशन कंडीशन क्रिएट करते हैं तो इट्स वेरी डिफिकल्ट, that aggravates pitta and vata too much. So have timely food to reduce or to prevent acidity and such digestion related issues. And type of food में आप प्लीज बहुत ज्यादा हॉट एंड स्पाइसी टाइप ऑफ फूड को कंज्यूम न करें. ओके, so too much of masalas and too much of spicy food should be avoided. Especially green chilies and red chilies should be avoided, and some of the masala items, garam masala, also to be avoided. And आपको ये फ्राइड आइटम्स उतना अच्छा नहीं है आपके सेहत के लिए, so avoid that also. And do not have meals late night. Okay, and one more thing, once or twice in a year go for panchakarma procedure of Ayurveda, and on a daily basis you need some blood purifiers. I hope you have made a note of all that I have told. Blood purification के लिए आप रक्त शोधक या फिर शोधक सिरप, कुछ त्रिफला चूर्ण फॉर रेगुलर डेली इनटेक, ऑल दीज यू कैन टेक इंटरनली. ऑल्सो एक्सटर्नली आप कुछ आयुर्वेद का लेपम्स अप्लाई कर सकते हो. ओके, वन वेरी सिंपल रेसिपी आई विल बी शेयरिंग विद यू ऑल in the coming days for face pack, face scrub, and some recipes. All these we will be sharing with you shortly. Okay, so pimples is a very common problem. Most of the people come to Ayurvedic physicians seeking for help, right? Next question is by Vinita. Vinita is asking, what is this? Just a minute. No, Ambika's question was that, right? Next is by Vinita. What is your question, Vinita? What are the advantages of oil pulling? Yes, oil pulling को हम गंडूशा बोलते हैं. So this topic I will be talking about on Monday. Once again, दिनचर्या के क्लास में. So oil pulling has many positive effects. See, how we have to do and what we have to do is early in the morning after getting up, after finishing our routine, that is washroom and all, after finishing that, we need to brush our teeth very well. I'll be talking more about all these in a chronological events, what after what should be done in Monday's class. As a part of this dinacharya, we have Gandusha also. So Gandusha should be done just before bath. So when you're doing that Gandusha, you will be filling your mouth full of either oil or kashayam or hot water. So oil pulling is one method of Gandusha. So oil को मुंह में रखने से oil is absorbed by the mucous membrane. So जो भी oil हमारे प्रकृति के लिए सूट होता है, that should be used. So when such oil is used, it helps in strengthening the sense organs as well as it develops a sort of strength. It strengthens the organs as well as cleanses. See, mouth is related to both digestive system and respiratory system, right? For strengthening these systems, again, it will be very helpful. So it makes you look and feel young for long years, right? So Gandusha has great benefits. It is a local treatment as well as systemic treatment. मुंह में कुछ mouth related problems like teeth issues or any sort of issues are handled very well with Gandusha. लेकिन कषायम यूज करना है या ऑयल यूज करना है या फिर सिर्फ वार्म वाटर काफी है, this will be decided by your Ayurvedic physician. Right? Next question by Vinita is, one second. She says, I am pitta predominant. No, where is yours? How often should be practiced? If you ask, it can be practiced every day. Gandusha can be practiced every day. I'm pitta predominant, so I do oil pulling with coconut oil. Actually, that is coconut oil is. Then is it okay? Yes, it is absolutely okay. No issues. Then again, another question is like, what is Ayurvedic perspective of veganism? See, in those days, there used to be a sort of understanding, cooperation, and there was very good, what to say, we were living in tune with nature in those days. But now, see, that is why cattle rearing, farming, these were all part and parcel of everyone's life. So, having milk directly from the cow, they used to rear cattle at home, so milk was not at all a problem. A very good quality of milk used to be available. So इसलिए आयुर्वेद में दूध के बारे में और दूध and then dahi and then takra, that is church, then butter, ghee, all these are very well appreciated in Ayurveda. Lots of high regards about all these animal products in Ayurveda. So Ayurveda says usage of these to be done for maintenance of health. Lekin I understand your present perception, present state also, that you might have turned into a totally vegan, you might have become a vegan. So you say that you are a vegan and strongly believe that commercial milk production practices are not ethical. Yes, it's very much true. Whatever you're saying is very much true for animals. Yes. So it would affect the quality of dairy product as well. You're 100% right. So Ayurveda was developed when farming practices were ethical. Yes, exactly. You have understood it very well. Is it okay to be a vegan and still follow Ayurvedic advices? Yes, of course, it is possible to be a vegan and follow Ayurvedic advices without compensating the efficacy, compromising the efficacy. To some extent, there might be some difference, like up to 80%, you can follow and get all the benefits of Ayurveda even by staying as a vegan. Don't worry. We will be there to help you, right? Yes. Next question is by Nishita Jain. Nishita Jain is asking, can we drink cow milk on empty stomach every day early morning? If at all your Agni is good and you have no allergy towards milk, no gas production, then that would be great if you can have milk on empty stomach. Really. Okay, you can. Then next question is by Saloni Gupta. Saloni Gupta is asking how to calculate Vata, Pitta, Kapha dosha. See, we have given you a questionnaire. Okay. So in that questionnaire, you will have to follow, you will have to answer all those questions and make a note of how many V's, how many P's, and how many K's you are getting. So the one dosha with maximum number of points will be your Prakriti. And the one with second highest will be in moderate level. And one with topmost was your Prakriti, isn't it? That will be the dosha predominance. Then one with less number of traits will be the less number of will be in less quantity in your body. लेकिन कभी कभी ये ऐसा भी हो सकता है कि आपके एक्टिविटीज के वजह से या फिर आपके आहार के वजह से या फिर सीजनल चेंजेस के वजह से इस क्वांटिटी में कुछ डिफरेंस मिल जाए. Yes, that is of course possible to have that. So to know more about what happens when Vata dosha is more, or what happens when Pitta dosha is more, what happens when Kapha dosha is more, what are all the diseases that we tend to suffer if we have too much of Vata dosha or Pitta dosha or Kapha dosha in the body, all these will be taught in advanced Ayurvedic course, right? I'm very happy that you're all coming out with very nice questions. I love the interest that you people have in studying Ayurveda. Next question is by Narinder Kumar. Yes, similar question I can see here. Is there any method to ascertain the quantity of Vata, Pitta, Kapha? No. Quantity in kgs or grams or mls, yes, it's very difficult. But definitely by repeatedly reading and by repeatedly seeing the patients, clients, and observing ourselves, our family members, we will be able to ascertain what is the predominance in the body. Okay, then another question by same person, whether all fruits like banana, papaya, apple, grapes, kiwi, orange, amrut can be taken together. Sir, my sincere suggestion to you, Narinder Kumarji, try to have fruits only of one variety at a time. So one variety of fruit at a time. If you want, if, अगर आपका मन कर रहा है कि papaya खाए, तो have papaya only alone. Do not mix papayas with citrus fruits or melons with citrus fruits like that. So concept of fruit salad and fruit salad with ice cream is really incompatible. So better don't do that. Instead, today if you're having one fruit in the midday as midday snack by around 11 o'clock, tomorrow you can have another type, or if the climate is favorable in the evening you can have another fruit. So best is just one or maximum two varieties of fruits in one day. That much is more than enough, right? Okay, Narindarji. Next is by Vinita Chauhan again. Is it okay to have honey lime in warm water every morning? See, honey should not be heated. I will tell you why in further course of time. Okay. Please do not consume hot water with honey early in the morning. No, please don't do that. Is it detoxing? Actually, it is not detoxing. It itself is toxic. Please avoid that. Can people with all doshas have it? No. People not only with all doshas, people who are healthy also, people who want to lose weight also are not supposed to have hot water with honey regularly. So it is actually very bad according to Ayurveda, because there are so many research papers nowadays that are seen on that about that. Ayurveda has totally said a big no to hot water with honey. So हनी को, शहद को कोई भी उष्ण वस्तु के साथ कंज्यूम नहीं करना चाहिए. हनी को कभी भी हीट भी नहीं करना चाहिए, और हनी को उष्ण ऋतु में पित्त प्रकृति वालों को एडवाइजेबल टोटली नहीं है. So always remember, honey should not be consumed with anything that is hot. Remember, this is the rule, and we need to follow this, because we are getting all the information and such conclusions from many studies that honey with hot water is toxic, and nowadays it is causing lot of fertility issues in males also, right? Actually, to tell you, being an Ayurvedic teacher, Ayurvedic doctor, practicing from the past 15 years, and also a teacher from the past 11 years. So I can say that confidently that honey with hot water is a total no. And we have been teaching about, see, as I told you that Bhava Prakasha Nighantu yesterday, that is authoritative, authentic text that I teach to my students of second year BAMS. So there, in that book, you find one chapter called as Madhu Varga. Remember, the name of the chapter is Madhu Varga. So इस मधु वर्ग में conclusion में it is strictly said that उष्णम उष्णार्कस्य. So honey को कभी भी hot water के साथ, hot substances के साथ कभी भी मिला के लेना नहीं चाहिए. Because what happens is, this is just a clue that I can give you. Honey, naturally available wild honey, is the vomitus of the bees, honey bees in the hives. So that nectar is processed in the body of the honeybee, and it is put out from the body of the honeybee, and that is collected as honey, isn't it? बी हाइव से वो हनी जैसे हम कलेक्ट करते हैं. लेकिन क्या हमें पता है कि वो नेक्टर कौन से फ्रूट से, सॉरी, कौन से फ्लावर से हनी बी ने लाया है? कैन वी हैव अ जीपीएस फॉर रिकॉर्डिंग द footsteps or the ways, or from which all plants that honey is being honeybee is collecting the nectar? No, it is not possible. See, there can be some poisonous plants also, right? So as it is, अगर हम हनी को कंज्यूम कर रहे हैं तो कुछ भी नहीं होगा. अगर हम हनी को हीट करते हैं या उष्ण पदार्थों के साथ संयोग करते हैं, the toxins become activated, the toxins are liberated. अगर ये टॉक्सिक सब्सटेंस को हम कंज्यूम करते हैं, it will definitely show some toxic effects, and we won't even realize it is because of that particular thing, because we are not aware about it, right? So awareness is very important. So always remember, actually hot water is very good for weight loss. Honey individually is very good for weight loss, lekin combination of hot water with honey is total no. Okay, so basically, especially in males, lots of fertility issues are seen. So that is why it has to be avoided, right? So now let me take up one or two questions from the message inbox today, and then for the last 5 minutes, let me speak to Sonia and Sonal. Okay, only two people today, right? How to balance doshas in the body? Yes, whatever we will be teaching you from this week onwards, Monday, Tuesday and all, ये doshas को कंट्रोल में या फिर नॉर्मल सी में रखने के लिए there are certain measures that we have to take. take, all those should be followed properly. So psoriasis के बारे में कुछ बता दीजिए. Jayant Kumar has asked this. What diet should we choose and what should avoid for psoriasis? What you have to avoid is basically विरुद्ध आहार को avoid करना चाहिए. Good quantity of protein rich food should be consumed. A very हिता आहार. So आहार के बारे में हम इस week कुछ बात करेंगे. Okay, then पैंक्रियाटिक एंजाइम्स को बैलेंस करने के लिए कुछ आयुर्वेदिक मेडिसिन दवाइयां लेना होगा, रोमी. So we will be talking about all those also in coming days. And then Palak has asked what to consume if a person has problem with milk and milk products, lactose intolerance like condition it is called as. So हम क्या करते हैं आयुर्वेद वैद्य लोग, we just give some medicines which would improve the metabolism and digestion of the specific condition for a person, and that is how we can treat this lactose intolerance condition. And in your syllabus you have that part, lactose intolerance. I will be telling you about that. Sonal is asking, can you suggest a yoga app? Yoga, see, I'm not very much trained, and see, I have, though have done this yoga instructor course, I'm not a right person, authoritative or authentic person to talk about yoga here in this platform. So better get in touch with the coordinators. They will be able to help you to get in touch with yoga teachers, right? Okay. So let me talk to Sonia.
हेलो मैम.
नमस्ते.
नमस्ते मैम. मैम मुझे जानना था कि मेरे को हेयर लॉस हो रहा है since 8 years after delivery and it hasn't been stopped yet. What could be the reason or how could I recover from it?
Yes. Okay. Yes, I will talk about this hair loss. Basically hair loss हो रहा है, इसका मतलब है nutrition अच्छा नहीं है. We need to have a very good source of calcium, protein, iron. All these three are very important for good hair. First thing. Second thing is regarding hygiene. Proper hygiene like washing hair 2 to 3 times a week is very important. Not just washing, drying it and then only tying it, not leaving hair haphazardly. All these are different methods that we need to take care of. This is second thing. Third thing is regarding the food and medicines. So as you know, deficiency के वजह से अगर hair का problem हो रहा है, तो we need to fulfill the deficiency. Give some nutritious food and drinks. For example, iron rich food like leafy vegetables can be consumed, all fruits. Then calcium rich foods like this milk and milk products, dairy products, I would suggest as being an Ayurvedic teacher, क्योंकि हमारे सेहत को, see, you can just go for some organic milk or desi milk. So all these would be from natural source. So I don't think any harsh methods are used in such conditions for causing any harm to the animals or not. Okay, so that is second thing. Third thing is we have some lehyas and rasayanams in Ayurveda for very good hair growth, like Narasimha Rasayana, Jivamritam, Agastya Rasayana and all. So we need to take more details from you for before we prescribe the medicines. And इसके साथ ही कुछ अच्छा सा ऑयल्स भी बनाते हैं हम, like आंवला का, भृंगराज का ऑयल्स, and see to it that there is no infectious or any such lesions or autoimmune diseases like scalp psoriasis and all, so that your hair health would be restored. And apart from all these, please check your genes. Huh? There is a notion that we apply good oil means lot of hair growth will be there. So that is there up to some extent. But अगर आपके जीनोटाइप में भी इतना अच्छा सा hair thing, if it is not there, then how much ever we do, it will come to a standstill over there. So deficiency and the type of water that you are using for hair bath, hair wash, that also should be considered. So seeing all these, we can give you a very good prescription of oil, shampoo, lehyas and rasayanams and some medicines for tackling your hair problem. Right?
Right. Thank you, ma'am.
Yeah. Namaste, Sonia.
Thank you so much, ma'am.
Thank you so much. Then let me talk to Netra. So it's already time up. So
Hello.
again, in the coming week, I would expect lot more questions in the query form, right? So Netra,
Ma'am, are you hearing?
yes, namaste.
Namaste, ma'am. I am also from South India, from Karnataka.
Oh, really?
Namaste, ma'am. Can I speak in Kannada?
No, no, no. In Hindi or English?
Okay. Actually, I have a daughter of 8 years old.
Hmm.
She's body is very cold. That means like kapha. She feels when it was the weather was changing, like cyclones and all. When it was very cold, she becomes very cough and sneezing in
Ah.
regular basis. So what is the?
Especially this Bangalore weather is horrible now.
Yes, ma'am. We are near to Bangalore. That is
We are
70
sitting here.
kilometers. You are from Bangalore, ma'am?
Yeah, yeah.
Okay. We are from Chikbalapur district, Chintamani. So
Okay,
70 kilometers from Bangalore.
okay.
So that's why.
But still, I think in South this weather
Yes,
very
ma'am.
here it is horrible. It is
Yes,
pushing
ma'am.
all of us towards illness. Right.
Yes, ma'am.
Ah, so for your daughter, I would suggest Netra some rasayanams, some lahyams, and
Okay,
then
ma'am.
some powders,
Okay.
tablets. So, but we need more detail. Anyway, we will be talking about respiratory problems also in the third week.
Okay.
थर्ड वीक में हम डिसीजेस को कंसंट्रेट करके क्लासेस करेंगे. So third week I will be able to discuss with you in detail about respiratory diseases. But as of now, I would suggest her some lehyams like Chavanprash, some
Okay, ma'am.
asavarishtam's like Dashamula, haldi ka doodh. That is actually
Haldi
very
ka.
good. Arshna dal pudi.
Hmm.
Some churnas like Tali Sadi Churan and Sitopaladi Churan, all these are actually very good for her. Anyway, please get in touch with our coordinator so that they will be able to help you get in touch with
Ma'am, any
Ayurvedic doctor.
diet changes, ma'am? Any foods
Yes,
that
yes,
will.
you have to totally avoid curds for her.
Okay, ma'am.
Early dinner is very important. Okay,
Yes, ma'am.
early dinner and no curds at all for some days.
But she's
Buttermilk
very
can be
fond
given.
of curd.
No, no, no. That
Uh,
itself is the root cause for this
okay.
respiratory problems. We are also very much fond of curds, but we know the
Yes.
problems
Uh,
related to that. So that is why we have all reduced the usage of curds. Curds are very good, actually, probiotics and many other
yes,
things. They
ma'am.
improve digestive system, digestive fire, everything. But still, curds should be avoided at night, especially. So what
Yes,
we
ma'am.
mothers do is when we see the child is not eating, we put curds
Yes.
in everything. Even with
Yes, ma'am.
chapatis, we give curds. With upma, we give curd. Dosa
Yes.
also curd. Rice ke saath bhi curds. So when we do such things, it's very difficult because that causes too much of increase of kapha dosha in the child's body. As
Yes.
such, बाल्यावस्था that is childhood में हमारे शरीर में कफ दोष तो बहुत प्रधान रहता है और ऐसे संदर्भों में वेदर भी ऐसा है and on the top of it we are giving curds. So that is triple positive.
Yes, ma'am.
So yeah, please. Okay,
Thank you.
right. Okay, then
Okay.
let me. Okay, so nice talking to you all. Please put all your questions in the query form. I will be answering all your questions. So from Monday onwards, let us start the class exactly at 5 and end at 6 o'clock sharp. So we will be there in the meeting from 4:45, but I'll be waiting for you all to come into the meeting. Okay, come soon and we will start early and discuss lot of things, and at least last 5 to 10 minutes we'll dedicate for question answers from this week, because this week may syllabus to moderate hai. It was only first 2 to 3 days that we had this problem, but yes, tomorrow no class, Saturday holiday. Happy weekend to all of you. So study well, all your doubts make a note. Okay, Thank you so much. Read well, go through the slides. Happy weekend. Namaste. We'll meet you all on Monday. Yes, tomorrow you have a test, MCQs. Correct.